Good evening. This is Dr. Sudarshan, the psychiatrist. I'm bringing to you the latest in the series of the videos on mental health, uh, with which you can cope with the various stresses during this COVID-19 lockdown period. Okay. Now, basically, what I'm dealing today is with the challenges for the healthcare providers. The healthcare providers, the doctors, the nurses, the pharmacists, the GDAs, or even the family members who are involved in the last mile care to the patient. Even they constitute part of the healthcare force. Now, what we are actually aiming at is to identify three zones for the healthcare providers, the healthcare workers. One is the fear zone, in which the healthcare professional actually suffers from fear. He or she is constantly complaining about the shortage of food, about the shortage of medication or the equipments. He or she is panicky, anxious, and also forwarding unconfirmed messages from authorities with doubtful credentials, and which are not substantiated. And in this way, basically, while we are living in the fear zone, we are actually helping spread our panic far and wide, and this has a domino or a cascading effect. The anxiety, depression, etc. Increases exponentially. Okay. Now, second zone is the learning zone. The learning zone is very, very vital. I also use the term mindfulness. Now, in the learning zone, basically, you have the insight. I mean, you acknowledge your problem. You acknowledge your problem that yes, I am anxious, I am feeling depressed. Okay. You talk to your family members, you talk to your friends, you talk to your colleagues, and you ventilate. Now, talking to colleagues is a thorny issue. People think that अगर मैं उसको बोल दूंगा तो वो तो उसको तो मजाक आएगा, तो he will take advantage of that also. Okay, in office politics. But you see, what you forget is that the person, the colleague whom you are speaking to, or even the relative whom you are speaking to, he or she himself suffering from the similar anxiety, and hence basically perhaps they wish to ventilate also. So if you ventilate to them, they will automatically get the idea that they can ventilate to you also. Okay. Now then, basically you have to shift yourself from the fear zone to the learning zone to the growth zone. Growth zone is when you have this realization and you act on it, and in this particular zone you actually utilize your experience of dealing with the fear zone and the learning zone, and help other members of the society, other members of the family, or the colleagues to cope with the problems. Okay, use your own learning to basically help the other members of the society overcome their mental health problems. Now, we are constantly wanting to avoid this anxiety. Now, anxiety is something which we cannot as such avoid. Okay. Now, anxiety, I'm not saying that anxiety is something desirable, but then anxiety also serves some good purposes also. It makes you alert. It makes you alert of the problem. It makes you take precautions, like this hand sanitizers we are using, gloves, mask, this surgical caps we are, or the hats we are wearing, and the cleanliness and disinfection of the house, of the workplace proper. And these are some things which are actually triggered by this anxiety. Okay, so it makes you cautious, it makes you So that is something perhaps which is quite desirable, isn't it? I mean, it's not totally undesirable. Now, you during this lockdown period, as I've always said, that you stay connected. You stay connected with your family members. You stay connected with your friends. No WhatsApping, no Facebooking. Okay, and meeting and using physical distancing and talking to them over the telephone. Now that is something what you should do. Now your mental wellness should not only depend on this Facebook likes and the WhatsApp wows. Okay, that is another problem, serious psychiatric problem which we deal with, also known as the screen affective disorder SAD, or the digital cocaine, or the nomophobia, no mobile phobia. If a person is allowed to or forced to stay away from his mobile for a period of time, then the anxious, the feeling of sadness which engulfs him is basically something which is not normal, and we should try and live happily even without this digital communication devices. Okay, now as I said, that you should not deny your feelings. You should not deny that you are suffering from sadness. You should not deny that you are anxious. You should not deny that you are feeling insecure. One more thing is that you please do not stock up or hoard on the items which are not that much essential. You just ensure that you have the proper, roti kapda makan. I mean, you have enough food on your plate, and you have the necessary medications if required. That's all. I mean, there's no need to stock up on food for months. There's no need to stock up on that hydroxychloroquine tablets, or someone using the homeopathic arsenicum album, and there's no need to stock up on this vitamin C and the zinc tablets. Okay, they're not that necessary. I mean, it's not necessary that if you stay without these, then basically it's not that you are going to die or anything bad is going to happen to you. You make these self checks, that whether you're suffering from depression, whether you're suffering from prolonged sadness, whether you're suffering from sleep disturbances, whether you're suffering from appetite problems, you're suffering from intuitive thoughts which are basically helping you to overthink, and overthinking never solved any problem, as you already know. Now, do not self-medicate under any circumstances whatsoever. Okay, and even if you're a doctor or you're a paramedic, do not self-medicate. This does not actually serve any purpose. And basically, as I said, that the mental health professional can help you, but you will only cure yourself or help you stay mentally fit. You are the person who will help you stay mentally fit. You can take the help of a mental health professional when you are doing this mental health self-check. You can talk to your peers, to your father figure, to your teachers, and of course to mental health professionals. Now, as I said, that you are your own caregiver. Okay. Now, if you have been liking my videos, please do like, comment, and subscribe to them on YouTube. And you stay well, stay mentally fit, help others stay mentally fit also. As a mental health professional, as a healthcare provider, it is most important that you yourself stay mentally fit and physically strong also. So till the next video comes on, bye from my end. Thank you.